Respect the health rights of India's children. Introduction. Today's editorial Respect the Health Rights of India's Children, written by Jayanthi Natarajan, highlights a shocking tragedy: the death of 25 children linked to contaminated cough syrup. Beyond the outrage, it raises deep questions about India's drug regulation, child health policies, and constitutional responsibility. The tragedy and the law. Despite a government ban on certain cough syrups for children under 4 years in April 2025, the syrup was prescribed by a doctor for a commission of just 2.54 rupees per bottle. The editorial calls this a national shame: the value of a child's life reduced to mere rupees. India's regulatory structure involves both central and state drug control bodies, yet poor coordination and weak enforcement have allowed substandard medicines to reach children. Focus on regulation, not blame. The author argues that instead of blame games, India must examine its fragile regulatory framework for pediatric drugs. Under Article 39(f) or the Constitution, a directive principle of state policy, the state must ensure that children grow up in safe conditions. Yet, pharmacovigilance for children remains neglected. Children as therapeutic orphans. Children are not small adults. Their bodies respond differently to medicines. But most drugs in India are taste only on adults, not children. This leads to dosage errors and dangerous side effects. Overseas, nations like the US and European Union have laws such as the Best Pharmaceuticals for Children Act and Paediatric Use Marketing Authorization that promote research and safety. India has none. Essential medicines and affordability. The editorial calls for India to adopt the WHO's essential medicines list for children more rigorously. Updating this list regularly would ensure availability, affordability, and quality of life-saving drugs for children. Strengthening oversight and awareness. There must be constant training for pharmacists and caregivers to dispense the correct dosage and detect side effects. Over-the-counter medicines for children should be strictly monitored, and substandard or substitute drugs must face zero tolerance. Global responsibility and data gaps. India, as a major exporter of medicines, must ensure its products are safe, especially after global deaths linked to Indian-made cough syrups in Gambia, Uzbekistan, and Cameroon. The author stresses that India needs its own pediatric research data instead of relying on foreign studies, as genetics, nutrition, and environmental factors differ. Conclusion for UPSC. The editorial concludes that the use of untested or unsafe medicines for children violates their fundamental right to health and dignity. India urgently needs a child-specific drug safety framework, indigenous data, and stronger public health infrastructure. Protecting the health of children is not charity, it is a constitutional duty and a test of our national conscience.